And get started. Thank you all for joining us this afternoon. We truly appreciate it. And again, thank you for being on time at 2 o'clock, even though that wasn't listed on the website. I appreciate you all's diligence for figuring out the time of our webinar this afternoon. My name is Anna Mondragon, and I'm going to facilitate some. And we do have a lot of agenda items today. So I just kind of want to give a heads up. Our webinars are from 2 to 3. This one may last just a little bit longer. So those of you who can stay with us, we appreciate it. If there's those who have to log off, please know that the whole thing is being recorded and we will post it up to the website within about a week. About a week is what it takes. So I'm going to head, because we have a lot, I'm going to go ahead and get right started. But we do have Donna Holmes and Jeremy McCaig here to share some information with you. So I'm going to mute myself and turn it over to you all.
Thank you, Anna. Hey, we're excited to be with you this afternoon. I'm going to go ahead and share my screen. I can get a quick confirmation that you're seeing our Child Find presentation there. Anybody?
It looks good. It looks good.
Perfect. All right. Well, once again, I'm Jeremy McKay. Good afternoon. I'm a statewide performance data analyst with TEA's Special Population Strategic Supports and Reporting Unit.
And I'm Donna Holmes, and I am a State Performance Plan Indicator Coordinator in the unit. And today we'll be presenting the TSDS Child Find Reflections and Review for the 22-23 data collection. Today's presentation will include information on reporting requirements, Child Find compliance indicators, the Child Find data collection, timely submission of data, compliance outcomes, results of the 22-23 collection, updates in TSDS, the 23-24 data collection, resources and helpful reminders, and contacts for questions and technical assistance. The Office of Special Education Programs administers formula grant programs that are authorized by the Individuals with Disabilities Education Act, or IDEA. And IDEA helps to ensure that children with disability ages 3 through 21 receive a free, appropriate public education in the least restrictive environment. IDEA includes Part B and Part C. Part B serves children ages 3 through 21, and Part C serves children birth through age 3. The Part B requirements are relevant to the Child Find collection. EA requires states to develop a State Performance Plan Annual Performance Report, or SPP-APR, to evaluate the state's efforts to implement the IDEA requirements and to describe how the state will improve its implementation. The SPP-APR is developed every 6 years and is submitted annually. Data must be collected on 17 indicators that are either performance or compliance-based. Performance-based indicators measure progress towards state-identified targets. Compliance indicators measure compliance with IDEA requirements, and the U.S. Department of Education's Office of Special Education Programs, or OSEP, sets the targets for the compliance indicators. Progress on meeting indicator targets is reported in the annual SPP-APR submission. Two of the 5 compliance indicators are included in the Child Find collection. Indicator 11, timely initial evaluation, and Indicator 12, early childhood transition. TSDS Indicator 11 includes 2 parts: 11A measures the percent of children who received a full and individual initial evaluation within the state-established timeline of 45 school days from the date the school received signed written parental consent. Now, there are some specified exceptions to this timeline. 11B measures the percent of children who received an eligibility determination within 30 calendar days, which begins the day after the completed evaluation. And there are also specified exceptions to this 30 calendar day timeline. Indicator 12 measures the percent of children referred by Part C, also known as Early Childhood Intervention or ECI, who are found eligible for Part B and who have an individualized education program developed and implemented by their 3rd birthday. The compliance target for both Indicator 11 and Indicator 12 is 100%.
How about if I unmute myself? Very good. So we know you all on the call today, we've given this same presentation with ESC folks and for TKs, but I know you all on the call today are boots in the sand out there, so no one knows better than you do about just the sheer level of complexity that's involved with the mechanics and logistics of these individual student compliance determinations as we move that data from the activities that are taking place to evaluate students and determine their eligibility, to have those ARDs, to make those decisions, to get things rolling into your student information system, into sometimes your third-party resource system for tracking, ARDs and IEPs, into TSDS, and finally into these compliance determinations. And so to provide a little bit of support with that, our data team, along with some of the technical staff and TSDS, have prepared some very helpful flow charts that are available to you on the TEA website at their respective SPP indicator landing pages. This one that you see is the SPP 11 flow chart, and so you'll notice at the bottom there that it's been updated for the 22-23 collection to include the information regarding that eligibility determination component of indicator 11, which we're referring to as 11B, whereas 11A is timely initial evaluation. So that's been updated, and that's available for you on the website. Likewise, we have a similar document available for indicator 12. This one is the same as what you've seen before. There will be some edits upcoming over the next year to reflect some changes that are on the way. But for now, this one is also available for you on the indicator 12 landing page. So as we think about the child find collection and how the individual student level data is funneled through and these compliance calculations are made, there are some really key data elements that we want to point out that really determine how the student is funneled into either indicator 11 or indicator 12 based on their individual demographics. And so firstly, students are included in the child find collection if they have an eligibility determination date that is between July 1st and June 30th of the reporting year. And so for this collection that we're referring to, this was July 1 of 2022 to June 30th of 2023. And so those kiddos, whether they were enrolled or non-enrolled, are included in the child find collection. So those who were aged 3 to 21, even if they were not referred by ECI, or those who had been in early childhood intervention programs for less than 90 calendar days prior to their 3rd birthday, move into the indicator 11 calculation. Whereas those who are below age 3 have, at the time of referral, and have those early intervention services in place for 90 calendar days or more prior to the 3rd birthday, those kiddos go into indicator 12. And the data element that you see referenced there in blue, the original ECI services date, is just what it says. That indicates when the students or the child's early childhood intervention services began with the provider. And that is used for the compliance determination. You may recall that previously this was determined by a pair of data elements that was basically an ECI indicator along with an effective date. And so that's been changed. It was changed for the 22-23 collection to include data element E1737. We want to make sure and remind everyone of the importance of keeping instructional calendars accurate and current in the TSDS system, making sure that there's an instructional calendar, instructional track that's uploaded into the system at the beginning of the year, as soon as they are set, as soon as you're able to do so. You work with your district PEMS folks to accomplish that, but also throughout the year, if there are changes to your calendar for any instructional calendars, campus calendars, instructional tracks, where kids have been or being evaluated, moving through the process, that you also upload a new calendar data into TSDS to reflect that. That might be things like bad weather days in the spring. We're notorious for those in Texas. Could be some other emergency provision, another type of waiver day. But anytime that calendar changes where there's a date that was indicated as an instructional day and has changed to be a non-instructional day or vice versa, make sure those get updated, because the system will reference those calendars to determine the timeline for completion of evaluation and make that compliance ruling. A caveat here is that for those carryover students, where you have a kiddo who's begun the evaluation process in one reporting year, but completes it in the next reporting year, TSDS will pull that prior year campus calendar from the appropriate PEM submission. There's nothing further that you need to do if you have those students who are being counted in that subsequent child find collection. And so the three data elements that you see there at the bottom are the primary elements that the compliance timeline is derived from, and that includes the instructional track indicator code. That tells us what calendar to attach the child to. The campus ID of evaluation is where the student has been evaluated, and the initial evaluation date, which is the trigger that gets the calculation rolling. So those are data elements E0975, E1710, and E1715. We always like to review just kind of the trend of dates of completion for the child find submission. This is kind of what we would kind of describe as a system performance metric, and there are some really positive things to show here. The window was a little longer for completion in 2022-23. You can see that window opened for completion on May 15th and closed at the deadline at 11:59 p.m. on July 28th. And there's always that spike there on the deadline. But I can tell you that it's about half of what it was for the 21-22 collection. There were, I think, 264 districts that submitted that completed their child find submission on the deadline. We know sometimes that's really hard, having to get your data in the queue and waiting to make sure that it's completed and accepted and all of that. And so we're always really encouraging about making sure that we're very proactive about all through the year, of course, promoting data. But at this point, once we get to the completion phase, to really start early on wrapping that data up, completing. That way you're able to take care of any possible complications that might arise from really kind of weird data scenarios that might occur around a particular child in their evaluation process. We see some of the stories that we hear in Tim's tickets that come to us are, each one's a little different. And sometimes there are really interesting little idiosyncrasies about how a child's moving through the process. And so where you're having possible complications, it's very important that you're working proactively so that you can get that resolved, get some assistance either from your regional TSDS Child Find champions, get those TIMS tickets in, work with the folks who can help you resolve those things. Also very important to make sure that we mention there are negative implications for a past due submission or for a submission that needs to request for a resubmission or extension for reasons that are not related to problems that are on the agency side or with one of the agency's contractors. And so that can impact your federally required element, that FRE number 2 for timely, reliable, valid data, which can in turn affect your determination level, RDA system. And so always really encourage everybody to get all those in time. And you can tell we had lots of little bumps and spikes all along the way through the window. And so that tells us there's lots of good proactive activity. So kudos to you all out there in the districts. So this is just a quick display of the interaction between the two components of indicator 11. We know that we have to get those children that are referred evaluated in a timely manner, but also have those eligibility determinations done. Those are measured separately along their respective timelines, and we know that we want to be compliant for both. To find ourselves in that pretty green box, compliance that you see there in the middle. These measurements are tied to the state performance plan measurement table. There's a link there at the bottom to the federal site for IDEA data. And so that link will be live for you when you receive a PDF of this presentation. Similar for indicator 12. Same interaction here between evaluation and eligibility determination, with the added component that compliance really is tied to not only having an evaluation done, having an eligibility determination done, but also having that IEP developed and implemented by the child's 3rd birthday. So we'll review some data that reflects statewide performance on these two indicators for 2022-23. And really at first, let me just acknowledge just the sheer volume of children who are being evaluated in the state of Texas. And so that number, once again, this year was up by another approximately 22%, 31,000, almost 32,000 children more than were evaluated in 2021-22. And so you can see in comparing the 2 years that we're looking at, of course, the orange bar represents the compliance rate before the clarification phase, that period where your staff are able to engage with the review and support division to possibly clarify some students who are showing as non-compliant that may be related to maybe some data integrity or quality issue. Sometimes there's some, there are some little hiccups between moving that data from your student information system into TSDS. But when you're able to provide that good documentation that everything was done properly and met timeline, and sometimes those can be clarified in working with review and support. And so that orange bar represents pre-clarifications, blue bar is compliance after clarifications. And so you can see that after the clarification period, our overall statewide percentage rate dropped a couple of percentage points this year. So that's something that we always want to be cognizant of. And so, we talk about percentage points, but I would even point out that, those non-compliant evaluations, those are individual kiddos, and that's what it's all about with the child find requirement. And so that's, a little over 5,000 students, but 5,449 to be exact, whose evaluations were not completed timely. And so we always want to encourage, that we're always pushing the bar on that. But 97% across the state is a very, very strong rate. I'll also point out again, the increase in just the number. And so while the percentage points are down, the number of compliant evaluations is up over the number from last year. And so accommodating for the increase in those evaluations. I know you feel that out there in your districts with the number of referrals that you're receiving. So kudos to you once again for that. I'll also point out just another system improvement. If you look at the margin between pre and post clarifications for 2022, you can see that was about 3 points. Whereas for this past year, that margin has shrunk considerably down to just about a 0.5 percentage point. And so what that tells us is that you all who are taking care of the data out there before it comes to the TSDS system are really working hard to, I would say, get it right the first time. And so there's less of a need to clarify, less of a need to make corrections along the way. So you'll know that the 11B component of the timely initial and eligibility determination indicator was not a new requirement, but newly reported and newly addressed as a metric in statewide compliance. And some of you may have seen that in a notification that came to you at the end of October. And so for that reason, you'll see that there was no change from pre to post clarifications for 2022 when we were at 95% because the 11B component was not included in those clarifications processes. So as we move to this past year, of course it was, and so you can see that we increased before clarifications from 96.5% to 97.2%. And so that's, again, very strong percentage of compliance across the whole state when you consider the sheer number of kiddos who are being evaluated. Performance in indicator 12, strong yet again. And so we know there are more moving parts and pieces to the indicator 12 calculation. So I'll kind of walk you through what you see here as the visualization is a little dense. But you'll notice that we're comparing performance across 3 collection years, 2021, 22, and most recent 2023. You still see the pre and post clarifications figures. But you'll notice that you have a cluster of bars for each year and data quality phase, and you have a trend line in blue across the top of the graph. So let me just kind of walk you through what you see there. There are 2 vertical axes here, and so the left axis peaking at 12,000 is going to be, that's a count frequency of the number of children, and that correlates to the clustered bars that you see and the counts that are indicated on each one. The vertical axis on the right-hand side represents percentages of compliance, and that relates to the blue bar that you see across the top. So looking at our cluster of bars for each year in data quality phase, that big blue bar is the total number of referrals coming from Part B programs. And so, we had that spike for 2021, 22, and 23, kind of back down to comparable levels. And so that was pretty consistent. The orange bar that you see is what I refer to here as adjusted referrals, and that's that total number of referrals reduced by students who maybe were found not eligible, students who had some parent delays, or didn't enter a Part B program until less than 90 days before their 3rd birthday. The gray bar, that's the good one. That's our compliant ECI transitions. The small yellow bar and getting ever smaller every point is the non-compliant transitions for early childhood transition. To the most recent point where that number is in double digits, you'll see 49 babies across the state had a non-compliant early childhood transition. So really great job taking care of getting those youngest children introduced into Part B services. Our compliance rate, really strong. Of course, that 2021 pre-clarification year was a little bit of an anomaly. We know that COVID things were going on and all sorts of complications, but peaking this past year with a post-clarification rate of better than 99%. So really strong performance in Texas.
Thanks, Jeremy. Going to talk a little bit now about updated data elements in TSDS for the 23-24 data collection. And we'd like to mention that these updates were made based on feedback from the field. And we'd like to thank everybody for the ongoing conversations, because your feedback really is vital for us improving the child find collection. We'd like to note that 2 data elements have been added. As Jeremy mentioned earlier, the original ECI services date, and it is the month, date, and year when an infant or toddler birth through age 2 became eligible to participate in ECI. The next one added is the consent to evaluation received date, and that's the month, date, and year that the LEA received the written consent for the full individual initial evaluation, getting that from the student's parents. And this data element is replacing the parental consent date, and that was the month, date, and year of the first instructional day following the date that the LEA received consent. We've had 2 data elements that have been modified. The first one is the ECI notification date, and the only thing that happened there was the description was updated for clarity. The next modified data element is the ECI transition conference date, and that was changed from a mandatory data element to an optional data element. If there's no transition conference held, then the LEA should not report this data element. But if there was a transition conference held, then the LEA is going to report that. There were 3 data elements removed from the 23-24 collection. The early childhood intervention code and the effective date data elements were removed. And like we previously stated, the parental consent date was removed because it's been replaced by that consent to evaluation received date. All of these changes are listed in the 23-24 TSDS Child Find Changes document, and you can find that posted on the SPP 11 and SPP 12 web pages. We're going to get there. Now, one of our web pages that we'd like to note that's been updated is the SPP 11, the Timely Initial Evaluation Child Find web page. It's been updated to include calculations and examples for both that 11A initial evaluation part and the 11B eligibility determination part. And to support the data element original ECI services date, the ECI Memorandum of Understanding between TEA and Health and Human Services, it's been updated to require ECI to include the date the child enrolled for Part C services in that notification they send to the LEAs. And you can view a copy of this MOU on the Early Childhood Special Education webpage, and this link will be live in the PDF. We'd like to point out some dates that are associated with the 23-24 collection. On September the 11th of this year, LEAs could start promoting their 23-24 Child Find data, and that data includes children with a SPED eligibility determination date between July the 1st of 2023 and June the 30th of 2024. And on October the 5th of this year, a to the administrator addressed letter concerning the 23-24 Child Find collection was published. And on May 20th of 2024, this coming year, LEAs can begin their Child Find submissions. And of course, the important date of the Child Find submission deadline It is July the 25th, 2024 at 11:59 p.m. Now we have a multiple list of resources that are available for the Child Find Collection. And once again, these links will be live when you get the PDF version. Remember that each Regional Education Service Center has at least one TSDS Child Find Champion, and this champion is certified to train and support local education agencies. We also have the TSDS Incident Management System, and that should be utilized for any technical issues. We have a TSDS knowledge base, which includes information regarding the Child Find Collection and instructions for searching the articles in the knowledge base are located on page 10 of the TSDS Incident Management System User Guide. An important resource is the TSDS Web-Enabled Data Standards, or TWEDS, and they describe the data reporting requirements, responsibilities, and specifications for all of our data standards. We have our SPP 11 and 12 web pages, and there you'll find information that's specific to each of these indicators. We utilize various opportunities to present Child Find data collection information, and these include presentations like we're having today. We have Zoom presentations with the ESCs, and you can find the schedules and archived information for these webinars and for the ESC Zoom meetings. In addition, you can find archived special education newsletters all on the Special Education Webinar and Newsletters webpage. And on this webpage, you can also sign up to receive the monthly newsletter. You can find contact information for TSDS general support on the TSDS feedback webpage. And also the To the Administrator address, or TAA letters, can be utilized to distribute information about the Child Find Collection at times. And TAA letters are posted most Thursdays on the To the Administrator addressed correspondence webpage. And last on the list is the archived TAA letters, and a link to sign up for the TAA notification are found on that same TAA webpage. And as a reminder, your ESC Child Find Champion is your first point of contact if you need support with the Child Find collection. For quick access to resources, you might consider bookmarking important Child Find websites. These could include, but aren't limited to, the SPP 11 and 12 web pages and the TWEDS webpage. And you can consider subscribing to the Special Education newsletter or the TAA letters. And last of all, you can always view the posted special education webinars. If you have program-related questions, please email those to the SPED mailbox. Any data submission questions should be sent to the SPP mailbox, and then a TIMS ticket should be submitted for TSDS technical questions. And with that, we would like to thank everyone for your time today. Please use that contact information on the previous page if you have any feedback, if you have questions, or if you need technical assistance. And like we mentioned, this presentation is going to be posted on both the Indicator 11 and 12 web pages, and I believe it'll also be posted along with the link to the video for today.
Absolutely. Jeremy and Donna, thank you. That was a ton of information. And there are some questions coming in, and I do let people know that I will forward those questions to Donna and Jeremy, and they will answer them accordingly. If it's an anonymous question, they may not be able to answer it directly, but sometimes those questions help us with FAQs and things. So Thank you guys very much. I have collected those questions. We've got Kelly Goodman here, who is next and going to talk a little bit about supplemental special education services.
Yes. Okay. Can y'all see my screen and y'all can hear me? Because I didn't want to pull a Jeremy, so I unmuted myself real fast at the beginning.
We can
All
hear you
right.
and see the PowerPoint. Thank
There
you.
you go. Thank you. All right. So my name is Kelly Goodman. My official title is I'm the Director of Strategy and Outreach, and I'm also the SSES Director. And so we have a couple updates for y'all. This looks like 4 updates. Really, it's just 2 like big things. One is that we are going to close this school year's application, and we're moving to an application window moving forward. And then the SSES Plus Medically Fragile program will be ending as well at the end of 2024. Then we're going to briefly talk about what kind of communications that TEA will provide to the LEAs. And then there's like a timeline slide at the very end. All right, so this is the big takeaway here. And all of this stuff will be posted on our website starting tomorrow. But the SSES application is closing for this school year on March 15th of 2024. And then it will not reopen until February 3rd of 2025. This is the same program that started as a result of COVID. It's still a one-time grant. Now we've had families that have had accounts for several years, or already spent their money, had an account at one time, but they're still not going to be eligible. It's still just a one-time grant. But if they miss out on it this year, they can still apply next year. The purpose for this, and it's going to be opening up the first Monday in February every year, and then closing 6 weeks on a Friday after that. The purpose of this is that we're hoping it's going to be a better user experience for parents. Right now we have super long wait lists and things like that. And so if we can just get everybody to apply in a 6-week time period, we'll have shorter wait lists or no wait lists. Our committee communications will be able to be more streamlined. Y'all will be able to pull a report at the very beginning of a year, and it'll essentially be the same kids for that entire year. We won't have to send as many updates of who your eligible students still are. This also allows us to use the most current data. As y'all know, we only really get one super accurate data upload every year in February. And the farther we get away from that date, the less and less we have that are eligible, which risks us having a lot of appeals and things like that. So that will also increase our transparency, both with families and with LEAs. And then we'll have a set funding amount each year now that this has been extended through HB 1926. Also, the SSES Plus Medically Fragile program, those are the $5,000 accounts for students who are identified as medically fragile on their IEPs, have that box checked. This program will be ending on December 6, 2024. Families still have plenty of time to spend those funds. When we get new data uploads in February, we'll rerun for medically fragile as well. But since the application's closing on March 15th, that'll be the last time that they'll be able to apply for the medically fragile program. If they've already had an SSES account and we determine now that they are medically fragile, they'll still get that $3,500 difference to be able to spend those funds. This is because these program funds were very specific. They're an ESSER funds. I always forget the number, 2 or 3. But those expire at the end of April of 2025. So in an effort to get all those funds spent down, we're going to end the program on December 6th. This slide's kind of busy. I should have made the font a little bit smaller in retrospect, but here it goes. So tomorrow we are uploading all of our website information, updating all of our FAQs to tell everybody that the application will be closing on March 15th. General information is going to be updated after March 15th rolls around. All that same will be updated to say the application is closed and when it will reopen. This isn't as a big of a secret for y'all because it's tomorrow, but please don't communicate this just yet to your families. Give us time to update the FAQs. Region 10, our service center that's been providing the technical assistance, they're updating their team today and then first thing tomorrow morning as well. As I'm mentioning here to y'all, I did this with the ESE SPED directors last week. I also met with TexCan to talk about the medically fragile program closing as well. And then we have about probably 5 to 6 series of social media posts that we will also post on TEA to kind of talk about, hey, here's a month left, we have a week left, as well as the medically fragile program ending. What we will provide LEAs or y'all, we will provide you with a list of all of your eligible students. This will include all of your students that we know of that are served through special education. One column will have if they're medically fragile, And then one column will have if they've already applied for SSES. It'll be very clear. You'll know exactly who these students are. This will help you know which kids, if they, like I said, if they've already had an account, we don't need you to notify them again because they might be kind of annoyed that you're already telling them again that the program is they've already taken advantage of it. So you'll get this list on January 5th. It'll be through ShareFile. If you've received your medically fragile list previously from Huck, you'll get the same list from him that way. We will also update our outreach letter, like a template letter for y'all to be able to send out. It will have both information about the application closing as well as the medically fragile program ending in that letter. And then it'll have like a place for your LEA name on the bottom. And then lastly, this is just kind of an overview slide, just to kind of get perspective on some big timeline events. So December 15th or tomorrow, we're going to update all that communication. January 5th, y'all will get the letter template to send out, as well as your list of eligible students. Then March 15th is when the application closes, as well as the last chance for medically fragile to apply. Then in December, we will send out a new list for your eligible students for next year's application window that starts on February 3rd of 2025. And then on December 6th, that will be the expiration date for those SSES Plus accounts. If they already have an SSES Plus account and they have like an expiration date that's before December 6th, we're going to push everybody to be that December 6th date. So the families will get a little bit extra time. Again, just trying to spend down all of those funds. And then the 6-week application window next year will be February 3rd to March 14th of 2025. And so each school year will have a 6-week application window. And that is my last slide.
Awesome, Kelly. Thank you.
How to stop
By
share.
chance, Kelly, if the LEAs have questions on those lists, is there a overall email? Would it be you or Huck that you would want them to email? Because I'm just
Yeah, they will
anticipating an
get
LEA has questions. So
Yeah, they'll get that list. Of course, we encourage you to reach out to Region 10. They provide all of our technical assistance, but you can respond to that email as well. And then we encourage everybody to check our FAQs as we update those far too often, but we update those very often.
perfect. Thank you so much, Kelly. I appreciate it. And well, the next item on the agenda, we're going to do a little bit of switching of the orders. Mandy's going to cover the discipline flow chart, and then after that, we'll have Dawn.
Okay,
Thank you, Mandy.
thanks. Yeah, thanks for letting me jump ahead of you, Dawn. I appreciate it. I am going to give you a little bit of a shout out because I'm going to talk about the discipline flow chart today. My name is Mandy Young, and I'm a technical assistance manager. I'm a special education technical assistance manager. So we push out all of these wonderful resources. And I wanted to show you where you can find the discipline flow chart. It's at the Texas Sped Support site. And if you haven't been to this site yet, please, we encourage you to visit. You can even sign up for updates up here. I'm going to scroll down here, this featured section right here. This is the document that Dawn is going to talk about next. I would encourage you, if you go to the spedsupport.tea.texas.gov, you can even follow along with her. So I'm going to talk about the discipline flow chart. In the search bar, I just typed in discipline and I searched, and it will pop up as the number 1 right under the technical assistance behavior supports and guidance document. I'm going to view this document and go to the chart. And let me make this a little bit bigger because it's got a lot of information on it. Okay, so this has been updated. You probably have seen something like this before. We've updated it this year. The title is Discipline Flowchart for Students Identified with or Suspected to Have a Disability under the IDEA or IDEA. I'm going to scroll down. I want you to see this key. That's the first thing that I would look at. They have a decision point, which is outlined in red. They have yellow, which is clarification, but not necessarily where you're going to go in the flow chart. It gives you extra information. An action, which is in blue, and then the Texas requirement, which is dotted reddish orange color. So any of the boxes that are in the dotted lines, those are just extra information. So you start here with the offense, student protected under IDEA violates the code of student conduct. And you can either go to the right and say, what does that mean? Disciplinary decisions. And you can click on any of these awesome statutes. If the consequence constitutes a change of placement, if it doesn't, then you go to days of removal, total more than 10 cumulative days. If it is, it takes you directly to this action point. If it's not, it tells you what to do next. It's a pretty easy flow chart to follow. You just go down to the next. If it's yes, if the offense involves weapons, drugs, or serious bodily injury, then you go over to this next action point. And then these, again, like I said, anything in orange is our Texas regulations. And it's been updated to include all of the new TEC 37. So the endpoint of this is to determine whether or not there's a manifestation. Discipline is not a manifestation, or if it is a manifestation, do exactly what to do next. That's pretty much it. I just wanted to show you where this was, kind of go through and show you the key. I hope that it's helpful.
Just on a side note, I know the ESCs are familiar with this, and many of the ESCs will have a specialist that also is familiar with the discipline flow chart that you can reach out to. So thank you, Mandy. Appreciate it. And last but not least on our agenda, Dawn. And we are seeing the PowerPoint, or actually the document, Dawn, but you're on mute, so.
Hello, everybody. I'm Dawn Vanderhule. I am the, excuse me, Child Find Evaluation and Coordinator. I am a technical assistant specialist on the special education programs team, and I am going to walk you through our guidance for the comprehensive evaluation of specific learning disabilities. And we hope we find it's pretty voluminous, so we hope you find this helpful. You saw this before, but if you want to take a QR code snapshot, you can find this document on the Texas Sped Support site. It was published in late fall. This is a copyrighted presentation. If you'll notice, on most of the slides, we provide the page number. We are not going to go through this page by page, so everybody take a deep breath of relief. But I'm going to walk you through it to at least point out some things. What is the purpose of this guidance document? Well, it's to serve as a resource for our local education agencies and our multidisciplinary teams as they work collaboratively to evaluate students suspected of having a specific learning disability, including dyslexia and dysgraphia, because we know dyslexia is an SLD, just as dysgraphia is an SLD. You will see an overview of relevant regulations. They may be federal, state laws. They may be federal, state regulations. You'll see educational disability condition elements. We will highlight best practices, and there will be special considerations related to the identification of a specific learning disability. On page 9, you will see the federal and state definition. If you remember, we broadened the definition of SLD in 2021, and now the definitions are aligned. We simply point out in the note, dyslexia is an example of and meets the definition of an SLD under IDEA and under Texas Education Code. Please follow me to page 10, and we will follow much of the flow looking at these key elements of Texas SLD identification. There's nothing new about this, but perhaps it's a new way of organizing the information because these are all key elements. Determination by an MDT, the observation in the student's learning environment in the areas of difficulty, documentation of inadequate achievement based on multiple sources of data, verification of appropriate instruction in reading and math, examination of exclusionary factors, and last but not least, confirmation of insufficient progress based on either response to scientific research-based intervention or a pattern of strengths and weaknesses method. So we start, of course, with the multidisciplinary team, and you can find this on pages 10 and 11. We know the team is made up of parents, guardians, evaluation personnel, the student's regular teacher, and other individuals with special expertise. And we added on page 11 a very important part, that someone with specific knowledge of the reading process, dyslexia and related disorders, and dyslexia instruction must serve on the LEA's multidisciplinary team when dyslexia is a suspected disability. Now we turn to page 12, and we wanted to show you a slide, and we just happened to choose observation. You will always know when it is a best practice. It's boxed, it's shaded in light blue, and because we all believe in continuous improvement, how we move these evaluations closer and closer to a best practice. So as you can read through this, these are best practice suggestions when conducting an observation. Now we move to key 3. And again, this is familiar information. What are the 8 areas of inadequate achievement for SLD? And this information is found on pages 12 and 13. We know oral expression, listening comprehension. You'll notice with written expression, we intentionally boxed the last sentence. And it says this is an area where students with dysgraphia typically demonstrate underachievement. Did the same thing for basic reading skill. This is an area where students with dyslexia typically demonstrate underachievement. Box that on reading fluency skills. 6, reading comprehension, mathematics calculation, and mathematics problem solving. We went ahead and thought it was very important to highlight dyslexia is a specific learning disability. You do not do 2 different evaluations. You do not do a dyslexia evaluation and then an SLD evaluation. No, one evaluation. And there is your citation. You know this one too. Page 14, it is multiple measures to determine achievement: informal, curriculum-based, norm-referenced, criterion-referenced. No one measure carries more weight than the other. It is the preponderance of the data, and it's based on the data for that unique child. On page 15, our multidisciplinary team should start with the review of existing evaluation data. What is all the rich information that is out there for the team to access? These are just some simple examples: previous school evaluations, existing outside evaluations and other information provided by parents, teacher information, report cards, and comments from previous school years, curriculum-based, local benchmarking screenings, and state assessments. And we absolutely highlight, use this rich source of information that is available. Additional sources of data. And we'll read some of this with you. It is important to gather information and data from several sources to ensure the evaluation is comprehensive and to provide evidence to support conclusions. Identifying if the student is underachieving in one or more areas is based on the preponderance of data rather than a single score or a piece of information. In the next bullet, we go on to say, and I'm just going to read to you the bolded sentence: evaluators should not rely on interpretive models or processes that exclude evidence of a disability based on predetermined score profiles or cutoff scores. And this is found on page 16. Appropriate instruction in reading and math. And this is key element number 4, found on pages 16 and 17. Now, some of this we understand. How do we know underachievement is not due to, well, the child really hasn't received quality reading instruction, for example. We're familiar with data that demonstrates the student was provided appropriate instruction in reading and or math. And we also are familiar with database documentation of repeated assessments of achievement at reasonable intervals, reflecting formal evaluation of progress of the student during instruction, which was provided to the parent of the child. And hopefully they look that we look at the data based on the child, and we look at, well, what are the other peers in the grade or the school or the district? How are they doing? There's also a section in here where we address extended school closures due to viruses. We're familiar with that. Could be natural weather disasters, and we talk about how to evaluate those students when they come back from extended school closures. The exclusionary factors. Folks are very familiar with these, our evaluators are, but we really highlight to them the multidisciplinary team has to look and see what the primary reason is. You cannot just go, well, the child has a visual impairment. Of course, they don't have a specific learning disability. I'm just going to paraphrase quickly. The child with a visual impairment is provided strategies, interventions, accommodations, modifications that other children with visual impairments are making progress. This child's not making progress. That triggers, I wonder if something else is going on here. So we really spend some time talking about that word primary that's pretty much been skipped over. Now, in Texas, 2 methods are allowed. We do know that a student, one of them is that using a response to intervention where the student must demonstrate an insufficient response to scientific research-based intervention, or exhibit a pattern of strengths and weaknesses, one of the components considered to determine whether the child meets the eligibility criteria of SLD. And we went ahead and said this because it's worth saying again. The use of a severe discrepancy between IQ and achievement method is not used to determine the presence of an SLD in Texas. We really encourage our multidisciplinary teams, our LEAs, to read through pages 19 and 21, not to just say, well, we don't use an RTI method, so I'm skipping that. Really encourage you to look at these particular pages. We boxed, the Department of Education does not subscribe to a particular RTI framework, but it does call out the core characteristics that underpin all RTI models. Students receive high-quality research-based instruction in their general education setting, continuous monitoring of student performance. All students are screened for academic and behavioral problems, and multiple levels or tiers of instruction that are progressively more intense based on the student's response to instruction. And we provide a link to that. And we also call out, just because you use an RTI method, just because you use a pattern of strengths and weakness method, does not replace the need. You still have to do a comprehensive evaluation, regardless of the method used. On page 21, 23, we get into talking about the pattern of strengths and weaknesses method. And there's some dense content there for you, but I am going to read the note to you because I want to bring this out. Significant variance, which is another word for discrepancies, among specific areas of cognitive function. For example, could be working memory, could be verbal comprehension, or between specific areas of cognitive function and academic achievement, is not part of the PSW method described in state rule. Remember, state rule broadened the definition of SLD in 2021. Applying a requirement for such a variance would result in excluding students who might otherwise qualify with an SLD. Again, pattern of strengths and weaknesses method, and we just point out there have to be, it can't be all weaknesses. Yes, it is a pattern of strengths and weaknesses. And you will see we say in there, no, there's not a prescriptive number. You have to have this many strengths. You have to have this many weaknesses. No, it is based on what? A unique individual child and the preponderance of the data. We do give a best practices call out box on pattern of strengths and weaknesses. Interpretation should be described in plain language that explain the student's results accurately and clearly to the parents or guardians and the rest of the art committee. Cautiously use interpretations generated from computer scoring systems, as these may not take into account other data or individual performance. MDTs use corroborating data and information to aid in score interpretation. MDT should examine and categorize each piece of data information, be it informal, norm referenced, when identifying patterns of strength and weakness. Whenever possible, use tests with the same normative samples. Be aware of profile differences that are a consequence of using tests with different normative samples. We move into talking about dyslexia on pages 23 and 24. There are specific evaluation domains and questions outlined in the dyslexia handbook that must be used when determining the presence of dyslexia. There is no single instrument, score, or formula that will automatically rule in or rule out dyslexia. Now, I will caution you at this point. You know the dyslexia handbook is being revised because of House Bill 3928, the State Board of Education. There are certain things they must address and revise in the dyslexia handbook in the spring. So it is better. We've had some people comment, well, the dyslexia handbook contradicts the SLD guidance. The dyslexia handbook is dated 2020. We've had two significant things happen since then. The definition of the identification of SLD was broadened in 2021. And now in 2023, we've had House Bill 3928. Again, on pages more discussion, it is not required that a student demonstrate a specific cognitive weakness on standardized assessments as demonstrated by achieving below a certain threshold to otherwise display a pattern of strengths and weakness relevant to the identification of dyslexia. This is just a nice visual. We're looking for strengths in. We're looking for deficits in. You can read that. And then there may have deficits in phonemic, phonological awareness, rapid naming, and/or orthographic processing. But notice it says may, it does not say must. This is very familiar to you. Basically, you're looking at, are there primary characteristics of dyslexia? In other words, that means unexpectedly low performance in reading words in isolation, decoding unfamiliar words accurately and automatically, reading fluency for connected text, that's rate and/or accuracy and/or prosody, and spelling. Remembering an isolated difficulty in spelling would not be sufficient to identify dyslexia. We also talk about dysgraphia. A pattern of evidence would indicate unexpectedly low performance, and we give you there. You're going to have strengths. We're going to be looking for unexpected low performance in handwriting, reading fluency, written expression, and or spelling. And notice that says and or, it doesn't necessarily mean all of those. And again, we say the same thing about may have deficits. We address impact on access and progress in the general curriculum. And you'll see where it says note, a statement of how the student's disability impacts the student's access and progress in the general curriculum is required as part of the IEP, including descriptions of how the disability impacts access to and progress within the general curriculum within the FIE will help ensure that the ARD committee, especially the initial one, has the necessary information to meet this IEP requirement. Hopefully, many of you have taken the standards-based IEP process training. And in Module 2, we are training teachers. You should, at that initial ARD meeting, you should be able to get this information from the evaluation. And this is not just a statement you slap on at the end. You're providing information. The child has unexpected low performance in reading fluency, then provide them with, this is where the child words read correct per minute. And then include something like, and other students in, say, for example, 3rd grade, read this many words correct per minute. So we definitely get into this in the document. Recommendations. And this is found on page 28, we are looking for recommendations for evidence-based interventions. This should not be the final page where a boilerplate of the same 10 recommendations that have been written for about 25 years are put. We're looking for what are the evidence-based interventions after all this information about a strengths and weaknesses or response to intervention. This leads us to, the preponderance of data leads us to recommend what evidence-based interventions and accommodations and needed modifications. Reevaluation. Most of this is fairly familiar to you, but I do want to point out the note. The emphasis in a reevaluation may not be the continued identification of a disability condition. And what we're really saying there is, don't automatically give 5, 10 more standardized tests. Hopefully, the team will look at a shift to a detailed description of how the student's disability continues to impact his access to and progress in the general curriculum. There should be a summary of IEP progress since the last evaluation, including the effectiveness of interventions, accommodations, and/or modifications. And that is found on page 29. Conclusion. And I hope evaluators, our LEAs will read this. As noted by the National Association of School Psychologists, SLDs are among the most challenging developmental disorders to identify, as evidenced by the continuing debate in the literature regarding best practices in this area. SLD identification is an evolving area. Hopefully, this guide will inspire others to continue to learn more. Practitioners are encouraged to continue reviewing the literature and seeking relevant professional development in the pursuit of continuous improvement. There are designated representatives at each regional education service center available to assist LEAs with procedures for evaluation. I hope this has generated some questions. And I don't want to leave you with, well, this is it, goodbye. We will continue to provide technical assistance. Just to share with you with what is planned this year, we're going to turn the guidance document into an asynchronous course in TEA Learn, providing, shall we say, non-examples and best practice examples, and expanding on this. This could not be a 100-page document, but we will be creating an asynchronous course. We will also be republishing. We've taken down the evaluating dyslexia in the FIE because with the changes to the identification of SLD and House Bill 3928, we really needed to do a rewrite of that. So we will be publishing that. We are getting questions, and we are using those. We're responding to those by developing training based on your needs. So I wanted to leave you with that. I thank you for this time. I know you have been with us for a while and it's the end of the day. So thank you very much.
Awesome, Dawn. Thank you so much. There was a question that came in on the title of that document. Can you rephrase or pull up the actual document again, just so they can capture the full title? And I appreciate the questions that did come in while Dawn's pulling that up. And we'll shoot any of those questions out to people who presented today for possible answers. And then sometimes those questions, again, help us with any FAQs. So
absolutely. I'm going to bring this.
I figured you had it pretty handy. There it is.
There it is. Guidance for the comprehensive evaluation of specific learning disabilities. I will share with you, if you go on Texas Sped Support, and if you just type in specific learning disabilities, just search that, it'll bring the document up for you.
It's probably the first document that pops up, I imagine, because it's getting a lot of
Yes.
searches right now. Probably the first document. So, well, this was well needed. Thank you for the information, Dawn. And I'm excited to know that there's some asynchronous courses that are going to be part of this for the evaluators across the state. So thank you all for your time today. Once again, we will post this recording probably within the week. So it will definitely be posted before the holidays. Thank you, everyone, and have a wonderful afternoon.